This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Monday, April 20th. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at our VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate your staying with us on Africa 54. Several countries are slowly taking steps to relax lockdown orders imposed to control the spread of COVID-19. World Health Organization Chief Tedros Adhanom Ghebreyesus says he is encouraged by nations planning to ease social restrictions, but he cautioned it is critical that these measures are a phased process. Most businesses and schools in the United States remain shuttered, sparking demonstrations against governors and their orders for people to remain sheltered in place. President Donald Trump says that some governors have gotten carried away with their restrictions and that people have the right to protest. However, some governors pushed back and say their states are not ready to reopen. Now to Africa, where Tunisia is extending its COVID-19 lockdown until May 4th. Then it will gradually ease restrictions on some economic activities, according to Prime Minister Elyes Fakhfakh. Zimbabwean President Emmerson Mnangagwa says mines and factories can reopen, but he is extending the country's coronavirus lockdown that was supposed to end Sunday for another 2 weeks. Nigerian President Muhammadu Buhari's Chief of Staff, Abba Kyar, died Friday of COVID-19. The 77-year-old had underlying medical issues, including diabetes. In Nigeria's northeast Borno state, an aid worker employed by Doctors Without Borders has also died due to the coronavirus. South Africa's 21-day COVID-19 lockdown is presenting an unusual challenge for a nation with the world's highest burden of HIV. In order to remain healthy, those on antiretrovirals need to leave their homes to pick up their life-saving medication, a move that puts them at greater risk of contracting the highly infectious disease. Some health advocates are seeking a workaround where patients would be able to get their medicine without human contact. VOA's Anita Powell reports from Johannesburg.
South African hospitals are busy preparing for a coming storm of coronavirus cases, which officials expect to peak in September. As they stare down this pandemic, though, they're also dealing with another, even bigger one. South Africa has the world's heaviest burden of HIV patients, with at least 7.7 million cases. Its government also runs one of the world's largest free antiretroviral programs. How, in this age of lockdowns and strict social distancing, can these vulnerable patients stay safe from a new viral threat? Enter the pharmacy ATM. South African nonprofit organization Right to Care unrolled the innovative program in 2018 to give patients with chronic illnesses their repeat medication in under 3 minutes. In normal times, the program saves patients the inconvenience of waiting in long lines at government clinics. During this new pandemic, it could save lives.
The interaction between a patient and healthcare professional is minimized, is very minimal. It's more or less virtual from the patient point of view because it's via an audio-visual link. So interaction, so the spread of the virus is limited because there is no person-to-person interaction because we're using audio-visual link. We're using an ATM pharmacy to dispense medication to patients.
The program's managing director, Fanny Hendricks, says it could also lift a burden off the nation's hospitals. Patients can get 2 months of medication at a time.
In a time like this, it's important that we decant our chronic stable patients from our overburdened facilities to make way for the side effects of the pandemic.
The program has 5 locations in South Africa, most of them in high-density areas in Johannesburg and the city of Bloemfontein. Most are inside shopping malls, which, under South Africa's strict lockdown conditions that only allow essential trips outside of the home, also minimizes the number of trips patients have to make.
We've seen a rapid increase in patient numbers at our ATM pharmacies. One of the main reasons for this is just remember that these ATM pharmacies are situated in community shopping centers. So in a period of lockdown, patients can easily align the collection of their chronic medication with their monthly or weekly shopping. And also the ATM pharmacies is open 7 days a week. And already we are open 80 hours more per month than the public healthcare facilities.
The program is busy collecting data on how many new patients have entered the program. But they say every single patient they can help contributes to the larger fight against the coming pandemic. Anita Powell, VOA News, Johannesburg.
The United Nations Economic Commission for Africa says at least 300,000 Africans are expected to die due to the COVID-19 outbreak, and tens of millions are at risk of being pushed into extreme poverty. Colette Luke has the details.
The COVID-19 pandemic will likely kill at least 300,000 Africans and risks pushing 29 million into extreme poverty, a United Nations agency said on Friday. The UN Economic Commission for Africa, known as the UNECA, is calling for a $100 billion safety net for the continent. But the head of the United Nations said much more was needed. Although Africa's 54 countries have so far reported fewer than 20,000 confirmed cases, the World Health Organization warned on Thursday that Africa could see as many as 10 million cases in 3 to 6 months. Most of Africa has already mandated social distancing measures, ranging from curfews and travel guidelines in some countries to full lockdowns in others. But combating the disease is complicated by the fact that 36% of Africans have no access to household washing facilities. The continent also counts just 1.8 hospital beds per 1,000 people, and it imports 94% of its pharmaceuticals. The health crisis could also shrink the continent's economy, pushing tens of millions of people into extreme poverty. Nigeria alone will lose up to around $19 billion in revenues from oil exports this year.
Colette Luke of Reuters with that report. The outbreak of the coronavirus is affecting people worldwide with no distinction of race, color, or social status. However, experts say the poor, people with disabilities, and other vulnerable groups can be disproportionately harmed. VOA Health correspondent Lino Mudu spoke via Skype with Melinda Gates, co-founder of the Bill and Melinda Gates Foundation, to discuss how the foundation is contributing to the global fight against the COVID-19 pandemic. Melinda Gates says addressing the needs of vulnerable population is a priority. The Bill and Melinda Gates Foundation has announced an expansion of its funding for the global response to COVID-19, including an additional $150 million. Tuesday on Africa 54, we'll have part 2 of Lino's interview with Melinda Gates as they discuss addressing community trust during an outbreak and the way forward.
Melinda Gates, thank you so much for your time.
Thanks for having me.
The world is seeing an unprecedented crisis with the global pandemic of the COVID-19 coronavirus. First of all, what are your thoughts on what we are seeing right now?
Well, we're still seeing it on the rise in so many places around the world. And I think one of the things we need to recognize as a global community is that COVID-19 anywhere is COVID-19 everywhere. And we're just starting to see the effects on the most vulnerable parts of the population. And I have to be honest, that's the thing that keeps me up at night.
The Bill and Melinda Gates Foundation allocated $100 million to help the response with COVID-19, especially in South Asia and Africa. Let's talk about Africa and the priorities on the continent with regards to this fund in particular.
Yes. So one of the things our foundation has been doing actually for the last couple of years is working to make sure that the African CDC is very strong so that there can be an African response. So we continue to work with the African CDC. We are doing disease modeling very proactively to show, as we get more and more data about how this disease spreads and who it affects the most in terms of vulnerable populations, we're putting that disease modeling information information out there. And so we're trying then to take that to various countries like Southeast Asia, as you said, or many, many countries we're working with in Africa to say, here's what you need to do to prepare your health system for what's about to come. The other thing that we're doing is trying to make sure people understand that testing needs to happen for everyone, and it needs to happen in a very equitable way.
Massive testing is definitely one approach that experts are saying will be very critical on the continent. How much of the resources have been allocated, especially to testing, given that it's an important step when we talk about preparedness?
Yeah, so testing is fundamental. You have to know who's sick and who's not sick. And if you don't do testing and don't do contact tracing, you will get mass spread of this disease. And so what we need to make sure is that testing kits are available, that they can be easy to use. And also, one of the things the foundation's been working on with the FDA here in the United States is working to show, could we have a home test kit available? Then you could get them out very broadly across Africa. Because as you know, one of the things that's going to be very, very difficult for somebody who lives in a township or who lives in a refugee camp is to social distance. So the only tools we have right now are physical distancing and washing our hands. I've been in many African settings where people don't have running water to wash their hands. So we absolutely have to help people understand who has this disease and who doesn't, and how do we help them self-isolate so that it doesn't become a widespread infection throughout an entire region.
So practically, how do we help vulnerable population, children, pregnant women, even refugees and others? What can we do in this case with COVID-19 to help them?
What do? We make sure, first of all, that they're fed. People need to be able to have a meal in every single day. They need to have food, because if you don't start there, if people don't have access to food, they have to go out and find food, bring food into their home. We know it's something we all need. So one of the most important things we can do right now, I feel, is tell people we need to put money into making sure that people actually have access to food. Then we have to make sure that women know if they're pregnant, where can you go safely to still do your prenatal appointments? Where can you go to safely deliver that baby? Don't deliver at home. We have to help, practically speaking, the primary health care system separate out the patients who come in who have COVID from, say, patients who come in and are pregnant. That is fundamental in terms of having the health care system still work and support women who are pregnant. So those are two very practical examples.
Even though right now Africa has less cases of infection of COVID globally, but health experts are still warning that there is a big risk on the continent. What do you see as the priorities then moving forward?
I think there's an enormous risk on the continent. I think we could see an explosion of disease. And so the priorities have to be making sure people are fed, then testing and doing contact tracing, and then from there, making sure the people who can physically distance themselves. And then we need to make sure lots of protective gear gets out, this PPE that we're all talking about that healthcare workers wear, and masks, so that healthcare workers can protect themselves and can keep the health system up and running so that those who are sick can still come in and get what they need. So we need to do a lot of modeling, too, on good data to say this is where the resources should go. And I think here in the United States, one thing we can do is make sure that we're not saying, oh, well, only the protective gear is for the United States or for Europe. We have to make sure it's distributed en masse, equitably around the world. Otherwise, the most vulnerable are the ones who are going to lose the most in this disease.
Asian markets traded mixed Monday as investors await further signs on the direction the global economy will take amid the coronavirus pandemic. Japan's benchmark Nikkei index was down nearly 1% by late Monday afternoon, while the indexes in Hong Kong, Seoul, and Shanghai were flat, and Australia's S&P was down nearly 1%. The fallout of oil markets continues, with the U.S. benchmark crude oil dropping 15% to $15 per barrel, while Brent crude, the international benchmark, was trading at just over $27 per barrel, down 1.7%. We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Still to come, we'll tell you how the coronavirus pandemic has impacted and transformed the world of sports. We'll be right back after this short break.
My people, now you ready to ride? Remix, Mr. Flavor, Valley Dance Hall, and a shower remix. What you gonna continue?
Welcome back to Africa 54. The battle against the coronavirus in the U.S. is now a political fight as state and federal leaders debate who gets more funding and COVID-19 testing. VOA's Elizabeth Lee has the details.
As doctors and nurses fight to save lives, a different battle is happening in the U.S. Congress. The debate where additional funding should go to after the money in the Paycheck Protection Program for small businesses was quickly used up. Republicans want more funding to only go to small businesses. Democrats want additional funding for a broader financial assistance package targeting more people.
We have an opportunity and an urgency to do something for our hospitals, our teachers and firefighters and the rest right now.
While the small businesses that did not get the first round of financial assistance wait in limbo, lawmakers are negotiating with the Treasury Secretary to come up with a plan.
We're continuing to negotiate with the Democrats to get our great workers and small businesses all over the country taken care of. I think we're getting close to a deal.
This political debate comes at a time when business and government leaders are eager to reopen America. Many Democrats critical of what the White House has done so far say a more centralized approach to massive testing across the U.S. needs to happen before life can go back to normal.
The key that opens the door to the economy is testing, testing, testing. We haven't done it right. He has not appropriately done testing, treatment, contact tracing, and quarantine.
The White House has been focusing on testing coronavirus hotspots. Coronavirus response coordinator for the White House, Deborah Birx, says a strategic approach to testing makes more sense.
None of our tests that we use in medicine can diagnose 100% of the people who are positive and correctly diagnose 100% of the people who are negative. These are very good tests, but if you utilize them in what we call very low prevalence states where there's no evidence of COVID-19, you can both have false negatives and false positives.
Some governors, both Democrat and Republican, are asking for more tests.
I believe if they want it, we should give it to them and get it for them and work with them. You must remember that the governors wanted to have total control over the opening of their states, but now they want to have us, the federal government, do the testing. And again, testing is local. You can't have it both ways.
The White House is working on testing through a public-private partnership, says Birx.
We have a team calling every single laboratory that has all these platforms throughout the United States. There's over thousands of them and over 300 labs, and they're calling everyone to work with each state and local authority to ensure that they have everything that they need to turn on full capacity, which will, we believe, double the number of tests that are available for Americans.
As federal and state leaders figure out the best way to reopen the country and get the economy moving again while minimizing more infections. Elizabeth Lee, VOA News.
In light of the COVID-19 pandemic, a very unusual graduation took place Saturday at the U.S. Air Force Academy. Vice President Mike Pence gave the address in person as nearly 1,000 graduated from the military school. VOA's Caroline Presutti has more.
Even in the days of the coronavirus pandemic, this is an unusual sight. Wide open spaces, and yet a crowd gathers without masks. These are the first-class cadets, called Firsties, graduating from the U.S. Air Force Academy in Colorado. Nearly 1,000 graduates, including Laura Na from Pennsylvania, who says the Firsties followed precise COVID-19 compliant lines.
They were drawn with paint on the grass, and they're 8 feet, little like 8 by 8 squares, and our chairs are placed at the front corner of each square. So we're all about 8 feet apart.
In a rare move during lockdown at other military facilities, Vice President Mike Pence delivered the graduation message. It's the first time he traveled outside of Washington in 42 days, but comes at a time when the administration is pushing to reopen the country.
And while we don't quite look like the usual graduation at the Air Force Academy, let me tell you, this is an awesome sight.
We didn't know that he was going to be coming, and so we were really excited because we thought it was going to be a virtual message given to our class, but then he came in person, and we were really excited about that.
The vice president singled out the 86 graduates of the U.S. Space Force. Those with the newly created 6th branch of the U.S. military wore silver sashes, while Air Force graduates wore gold. Unlike other years, no lower-class cadets, family, or friends were in the audience, and there was no march to the stage for diplomas.
On behalf of your Commander-in-Chief and a grateful nation, thank you for your service. Aim high, fly, fight, and win.
Lieutenant Na will attend nursing school in the fall, with the goal of becoming a combat nurse. The pandemic galvanized her career.
But if anything, I've just been more eager to be a nurse and to be in the health professions.
Class of 2020! Dismissed!
Hugs were banned, so the graduates cheered in place. Even with the ceremony's restrictions, this graduation will go down in history as the strongest effort to show normalcy in the middle of the coronavirus. Carolyn Presutti, VOA News.
Women's colleges in the United States have a rich history. Though long-term trends over the past 2 decades shows declining enrollments at women's colleges, some schools have seen an uptick recently as young women look for safe spaces to learn and grow their confidence. Isha Sarai has more.
Young women who decide to attend a single-gender women's college often face the same dated questions, including about their choices. How will you meet men?
I thought that it was kind of ridiculous, my thought process was like, well, I'm gonna have to work with men later on in life,
But since 2017, more young women are dismissing myths and stereotypes about women's colleges. Many say they're embracing women-only spaces.
Touring Bryn Mawr as a junior in high school, I quickly realized that it's not about the absence of men, it's more about the presence of women. The space was built with women in mind. Women don't have to fight for their place. And so you can just focus on making yourself a better person rather than just like trying even to find a spot.
Social and political events in the past few years, including the Women's March in 2017, have drawn younger women to women-only spaces for a number of reasons, including sexual assault on campus and the Me Too movement that pushed back on that violence.
I think definitely the political climate shifted. I think after the 2016 election, we definitely saw, an uptick in young women looking for these spaces where women are empowered and they're empowered to use their voice. I think the Me Too movement, and similar movements have also encouraged women to be in these spaces.
Students at women's colleges say they are more confident and feel better prepared for the workplace.
I noticed that when I worked at Princeton University last summer, I worked with college-age men for the very first time in like 4 years. And I was like, wow, this is really interesting. And I noticed that out of all the women in the group that I worked with, I was the only outspoken one. Like, I was the one very confident in what I had to say.
But women's colleges in the United States have faced financial problems in the past decade, struggling to enroll young women.
A number of years ago, enrollment at women's colleges was soft. But I would say that in this new environment of women's empowerment, of the value, the understood value of multiculturalism and leading diverse teams, that enrollment is actually on the rise. Our applications have increased by 100%.
I think the challenge is always, talking about what will that return on investment look like, and debunking a lot of myths.
For the time being, women's colleges are enjoying a renewed interest from high school graduates who are looking for focus and strength. Isha Sarai, VOA News, Bryn Mawr, Pennsylvania.
In sports news, amid the coronavirus outbreak, several California colleges are moving ahead with e-game competitions, normally held as spectator events, with players facing off remotely from their homes. Here is VOA's Michael Sullivan.
Finish it. A remote practice requires concentration and teamwork.
Esports is just as competitive and just as exhausting as any other sport. You're using your brain, you're communicating, you're having strategic plans, and it's the same format as like baseball and stuff.
And it's challenging like chess, says an esports player who studies mathematics. He says the skills are similar.
You can discuss like multiple ways to solve one to get like the same answer. And I feel like you can do the same thing in esports.
Esports is a billion-dollar industry with professional teams and competitions that draw thousands of spectators who come to see the world's top gamers. The computer-based sport also offers professional opportunities.
Event planning, logistics, purchasing, the business side is a big side of it, accounting and finances. So we try to do an event where we try to integrate all those aspects into the whole esports event.
When not locked down at home, pro players compete for trophies and prize money. At the college level, some get involved for enjoyment.
So I was like, all right, let's just go for it. And next thing you know, I'm here, I'm making a lot more friends, and it's really fun just to be on a team.
This computer science student is developing job skills.
And now I help with the social media marketing. I make a lot of the promotional graphics. I help with administering a current website for the association.
Some professional athletes are turning to esports in their time in isolation. It offers virtual competition without boundaries and does the same for student players.
Essentially, we're able to compete with other people from across the world and get connected with other people that we wouldn't typically be able to meet in person, which is pretty neat if you ask me.
Professional teams are getting involved in online gaming as the line between sports and esports starts to blur. And esports comes into its own in a time of pandemic. Mike O'Sullivan, VOA News, Los Angeles.
And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thanks for watching.